What's up, everybody? My name is Max Feinstein, and for 13 more days, I'm still an intern in the anesthesiology residency program at the Mount Sinai Hospital in New York City. I wanted to use this opportunity to share what I think are the most important pieces of advice for you as you get started with intern year. This advice comes from my experience having rotated on a number of different services, including general medicine, COVID medicine, general surgery, vascular surgery, the emergency department, a number of other services. So I've really gotten a taste of what it's like to be an intern on a number of different services in the hospital. So this advice is really distilled down to be useful for pretty much whatever rotation you're going to be on during intern year. If you find this video helpful, I'd really appreciate if you like the video below and also subscribe to the channel. I think that fundamentally there are two characteristics that make somebody a great intern. And so it's actually really simple. The first thing is that you just need to be motivated. If you have a strong work ethic and you can get stuff done, that's half the battle. And the second essential characteristic of a great intern is someone who's extremely well organized. Now, these really go hand in hand because honestly, the biggest thing about intern year is that you just have a ton of stuff to do. And so if you can keep all of that stuff organized and you're also motivated to get through it, then you're gonna make it through intern year. Now, it can be a little intimidating as you get started because you're gonna have stuff coming at you left and right. It's gonna be like, hi, doctor, the patient's asking for something to help him sleep. The patient's asking for 1 milligram of IV Dilaudid. Dr. Feinstein, if you can go ahead and call those 7 consults before round starts, that would be fantastic. You said the patient's finger stick is 860. What? We've tried to draw labs 7 different times and weren't able to do it. So if you can come by and just get the labs set. Dr. Feinstein, if you can go ahead and just write progress notes for all 31 of the patients. And is going down for an MRI right now and is on a ventilator, so it needs to be accompanied by an MD for the next 3 hours. Just take a deep breath. It's all gonna be okay. All you have to do is manage to stay organized and have enough motivation to get all these tasks done, and you'll be just fine. So I'm gonna spend some time talking about how you can be really well organized to set yourself up for success during intern year. In the days and weeks leading up to intern year, I'd recommend that you get familiar with the hospital system if you can. Just walk around, get a sense of where the buildings are, what they're called, what the different floors are. So that way, when you need to get from point A to point B to point C, it's really easy for you to navigate through the hospital. Along those same lines, I'd recommend that you get familiar with your hospital's electronic health record system, assuming that it has one. So even if there's Epic at your hospital and there was Epic at your medical school, chances are that they look a lot different from each other. So I'd just spend some time getting familiar with a couple specific things. Number one is you want to make sure that you've got a good layout for your EHR. So that's going to be making sure that you've got a good place where you can see vitals, you can see labs, you can see notes, anything that's going to be pertinent for your daily flow. And then the other thing is that you want to make sure that you've got dot phrases or whatever the templates are for notes that you're going to be writing, because chances are you're going to be writing a lot of notes. So anything that you can do to efficiently organize and write your notes is going to be very helpful. To get set up with all of this, I'd recommend that you talk with a senior resident and see if they'll just spend a couple minutes sitting down with you, getting everything all set up in your EHR, because remember, they were there recently, so they should be able and interested to help you get all of this set up. And as long as you're getting advice from somebody who's already familiar with the hospital system, I'd recommend that you learn how to use the paging system. So whether that's using the phones to page or it's through the computer, it's just good to know how to send pages in case there's a code that happens, you need to get in touch with your senior, your attending, a consultant, whoever it is. So just make sure you know how to use the paging system. Now I want to move on to the stuff that you need to stay organized. And the number one most important thing that you're going to need to stay organized throughout the entirety of intern year is a multicolored pen. No, but seriously, I cannot overstate how important it is to have a pen in order to keep track of all of the information that's going to be coming at you. And if it's multicolored, it's gonna help you sort it out really easily. I put a link below to the pen that I use and I see most commonly on the wards, which I highly recommend that you get a couple of. Next up on the list of important stuff that you should be carrying around with you is a stethoscope. Now, I've been on some services where a stethoscope isn't exactly seen commonly on rounds. Surgery. But look, if you're gonna be seeing patients every day and you run into any problem where a patient's having difficulty breathing and you need to quickly find out if there's something that's going on, you're worried that there might be a pneumothorax or an aspiration, you can just quickly listen with your stethoscope. And of course, when you're pre-rounding on your patients every day, you should be listening to them. So just make sure you carry a stethoscope with you. I'd also recommend that before you start intern year, you stock up on bulk snacks and you make sure that they're snacks that you can fit inside your white coat pocket. So my favorite snack to carry around with me is a calorie-dense Gatorade protein bar. This thing has 400 calories, and if I'm going 6 hours without anything to eat, and I've got this in my white coat pocket, at least I can pull it out and have something to get me by. In addition to nourishing your body, you're also gonna need to nourish your cell phone because you're gonna be using that thing constantly and it's gonna run out of batteries. I'd recommend that you use a portable charger so that no matter where you are, you can always give your phone a charge if it needs it. Personally, I use this portable charger from Anchor. It lasts 4 or 5 charges and was pretty cheap to get, and it fits easily in your white coat pocket. There's also a link for this down below if you want to check it out. The next piece of advice isn't super essential, but it's something that can be helpful, which is a pulse oximeter. So depending on your hospital setup, you might not have pulse oximetry readily available in every patient room. And if you get called to evaluate a patient who's having difficulty breathing, it's really helpful to just be able to throw on this pulse oximeter and see what their O2 sats are. Next up, I want to spend some time helping you think about getting organized for pre-rounding. So that's going to be the time that you spend getting familiar with what's gone on with the patient since the last time you saw them. It's going to be information that's going to be important for you, not just for rounds, but also throughout the course of the day. In no particular order, things that I think are important for pre-rounding include talking with the nurse to see what's gone on overnight or since the last time you saw the patient. Also, looking at the records and seeing what sort of changes have happened both for vital signs and also for labs. So you want to know not just what the latest vital signs and labs are, but also what are the changes in the last 24 hours, because that's going to make a huge difference. Patient's creatinine is 7.9. Oh my God! Oh wait, they've been in renal failure for 7 years and are getting dialyzed tomorrow. I just want to highlight that there can be some very subtle changes in vital signs that can be early indicators of major problems that are coming up. For example, if you've got a patient who spikes a baby fever of 100.4, that might be the first indicator that they're getting some sort of infection that you need to work up and treat. Same thing applies for heart rate. For example, if you notice that a patient became tachycardic overnight, that could be an indicator that they've got a new onset DVT that you need to work up. So stuff like that, you just need to keep a close eye on every single time that you're rounding. When you go to actually see and talk with your patient, there are several things that I think you must do no matter what service you're on. And these are things that you should be doing every single day that you go see the patient. Questions that you should be asking your patient every single day, every time. Are you having any chest pain, any shortness of breath, nausea, vomiting, diarrhea, abdominal pain, problems urinating, problems pooping? Any abnormal answer to this question is potentially going to point you towards a new illness that the patient's developing, and particularly for someone who's been in the hospital a long time, things like aspiration pneumonia are going to manifest itself as shortness of breath, or somebody who's got a cardiac issue going on, you're going to have some chest pain, or maybe you've got a patient who's post-op from an abdominal surgery and they're starting to develop some constipation. It could be an early sign of an ileus, or if you've got a patient who recently had a Foley in place and they're not peeing as much as they used to, they might have some sort of obstruction that's developing. So these are things that are really easy for you to ask about, and you really should be asking your patients every day. You should also be examining your patients every day with at least the bare minimum, which includes listen to their heart and lungs, do an abdominal exam, look at their skin, check their volume status. Are they fluid overloaded? Are they really dry? Are they cold? So these are all things that are going to be helpful for you in thinking about what's going on with the patient. And remember, as the intern, you're the person who's going to be reporting to the rest of the team. So any finding that you have is going to be really helpful in directing care for this patient. And as long as we're talking about patient encounters, I just want to go ahead and say that if you and the patient don't speak the same language, then it's vital that you use an interpreter to communicate with your patient. Can you imagine how unfair it is to be a patient who doesn't speak the same language as their provider and you don't have a way of expressing yourself? Now, obviously, these are just the bare minimum components of a patient encounter, but the sort of time pressures that you're going to be under to pre-round on a certain number of patients and get all of your tasks done is going to make it tempting to skip over some of this, but don't. Just keeping these simple components of an exam in mind as you go through your intern year are going to help you make sure that you pick up on a lot of stuff that otherwise might be easy to miss. Next up, I want to share with you one of the biggest challenges that I didn't anticipate for intern year, which is how anxiety-inducing it can be to call a good consult. And the reason for this is that I, at least at the beginning, didn't have a good understanding of why I was calling a lot of the consults that I was calling, so it made it hard for me to be able to answer the questions that the consultants inevitably had. Yeah, Dr. Feinstein, if you can go ahead and just call cards to get their 2 cents on what they think about these tropes, that'd be great. Hello. Cards. Cardiology? Yes, this is Max Feinstein, one of the interns. I'm calling because there is a patient who has a past medical history of hypertension, diabetes, hyperlipidemia, hypercholesterolemia, hypothyroidism, peripheral vascular disease, peripheral artery disease, and he now has troponins of 0.50. Can you come see him? Are there any EKG changes? Oh, EKG changes? Did he have any tropes yesterday? Oh, his tropes yesterday were 0.42. Has he had any major stressors recently? Oh, well, he did have a coronary artery bypass graft yesterday. Right, sounds like a trope leak. If you need anything from us, just call us later. So let me give you a couple pieces of advice for calling good consults. The first is have a specific question in mind. That's going to make it really easy for the consultant to understand how they can help you. Also, when you're calling the consult, I would just frame the consult so that the person you're talking with can easily triage what's going on in their mind. For example, I've got a 64-year-old patient who's post-op day 1 after a cabbage. He has a trope rise today, some EKG changes. I'm concerned about ACS. Can you evaluate? And also keep in mind for calling consults that it's better for everyone if you can call earlier on in the day as opposed to later in the day. That's going to give the consultant more time to see the patient, talk with their attending, come up with a plan, and get back to you. So I want to wrap up this video by giving you some advice that I think is important not just for intern year, but really just for being a doctor. The first piece of advice should pretty much go without saying, but it's worth stating explicitly and just reminding yourself that you should never lie. From time to time, it can be tempting to tell little white lies to make it seem like you were a little more thorough or you remembered something that you didn't. Yeah, Dr. Feinstein, this patient's a little more tachypnic today than yesterday. Were they having any pain to palpation in their bilateral lower extremities on exam this morning? Nope. No pain. Even if you're concerned that it makes you look a little less thorough or like you forgot something, it's much better to just be honest because otherwise you might be jeopardizing the patient's health. You also definitely don't want to have the reputation as the intern or the resident who makes something up. Next up is to always ask for help if you need it. That means asking a co-intern, a senior, an attending, whoever it is, but if you're in a situation where you don't know what to do, just ask somebody for help. And remember, everyone has been in your shoes before. Everyone has placed their first IV, everyone's put in their first NG tube, managed their first DKA, whatever it is, just ask somebody for help if you need it. Next, always do right by your patients, even if that means refusing to do something that your senior or your attending asked you to do. Yeah, Dr. Feinstein, we're rolling back to the OR in 7 minutes, so if you can go ahead and just consent the patient for the aortofem-fin bypass that we're about to do, that'd be fantastic. An aortofem what? But seriously, if you've been asked to do something like consent a patient for a really complex case that you know nothing about and you don't have enough time to read up on it to become familiar with it, it's not okay for you to be walking the patient through the consent process. Something that's more generalizable and relevant right now is PPE use. So if you're going to see a patient and you're not given enough PPE in order to protect yourself, then don't go see that patient. It is not ethical for you to be seeing patients if you aren't protecting yourself. The last piece of advice that I've gotten a lot of mileage out of during intern year is to trust but verify. Hey Max, this is the overnight intern. I just wanted to let you know that your patient spiked a fever last night, so I went ahead and sent a sputum culture. Dr. Feinstein, it looks like this patient who's been vented for 45 days spiked a fever for the first time and has some diminished breath sounds bilaterally. Send off that sputum culture? Oh yeah, for sure. We definitely sent off that sputum culture. Huh, what is this sputum culture doing here? It's typically pretty easy to double check that stuff's been done. For example, you can just call the hospital laboratory and make sure that they received and are processing a culture that you've sent to them. Patient care is really complex and involves a lot of moving parts, and so part of your job as the intern is just to make sure that everything flows smoothly. So that's why it's a great idea to double check. Well, that wraps up this video of advice that I think is most essential to start your intern year. I wish you the best of luck as you get started. If you have any questions, please leave them in the comments below. Thanks for watching, and I'll see you next time.